Hey, before you even get started with this content, make sure you download our free low back pain relief guide. It's a completely free guide and it's gonna help you with your low back pain. Let's get into it. So what's going on with your shoulder?
It's almost gone. The only problem I always have is the lower back.
Okay, so the lower?
Yeah.
Okay. Right side, left side?
I could say more to the right. And sometimes get stiff, like when I get up, I feel like something pinches and I feel.
Now where do you feel that?
Down here.
Okay. And what does it hurt to do, as I asked before?
When I get up in the morning, I can't walk straight. Like I gotta bend a little bit, and I feel like something is pushing here. It just makes it difficult to walk straight.
Okay.
Yeah.
And that's only in the morning?
Mostly in the morning, yeah.
Okay. Never at night? Never during the day?
No.
Never after activity?
Not really. It's just more of after sleeping. Like 7-8 hours
Okay.
sleep and then you wake up. That's what.
Okay. What do you do to make it feel better? Or does it just go away on its own?
I do some exercise, like I do one, which is this.
You could have went on the mat, but all right. Okay, that's not too bad.
I do one.
So some glute
The
bridge.
other one is this,
Okay, that's good.
and we did this.
So we call that windshield wiping.
And then the other one is this.
Does that help it? All of it?
Some, yeah.
Okay. All right, let's do full flexion. So bend forward, touch your toes, see if you can get it. Does that hurt?
No.
Okay. Rotate, rotate.
Left and right.
Yep.
Not
Okay.
much. No.
Extend back. Watch your head. Good. And then lateral bend, right and left. So no major deficits so far.
No. A little bit of feeling and the
Going
lower
into
back.
the right side?
Just here in these two areas.
Okay. So it looks like it. So that we have to differentiate between SI joint and lumbar spine. So we'll go quickly. Let's go into your back, face up. We're gonna do a nerve tension sign first. I typically do SLR, straight leg raises. It's always on the right side?
Mostly.
That hurt?
No, I feel pulling here.
Good. That's exactly what. Nothing in the back here?
No.
Nothing there?
No.
Does it hurt to go more forward or backwards? Like bend forward or more backwards?
You mean what,
in the
the
morning?
legs?
In the morning.
More forwards.
Okay.
More backwards actually, because I gotta lean to the.
I think this is what we call extension intolerant lower back pain. Again, fancy word for saying it hurts to go backwards.
Right.
It hurt?
No.
Okay, let's go into your side. We'll face that way. We're gonna work a little bit of the iliolumbar ligament.
The only thing is, for years I used to have pain here, right in for the crutches.
Groin?
When I used to like wear my pants or something, I used to have a lot of pain here. It's almost gone. So I wasn't sure.
Like
it
a
has
pinching.
anything
So we're gonna work a little bit of the iliolumbar ligament. I think there's an extension intolerance, fancy word for saying it hurts to go backwards. And this typically happens after, sometimes people have old discs that get irritated and then they go away and then they develop some sort of arthritic changes in the spine, but it affects his extension. But right now, the symptoms aren't very, very hard. So that's a good thing. So we're gonna come in, we're gonna go right into the iliolumbar ligament here, which basically attaches. This is a good way to treat both the lumbar spine and the SI, because it kind of does like almost like a C shape or a J hook here. So what we're gonna do is I'm gonna come in, I'm gonna lock my hand into the iliolumbar ligament. You okay there? Does that hurt?
Yeah, no.
Good. And I want you to come here, take a deep breath in. I call this open book. You okay?
Yeah.
Good. Go ahead. And all the way open. And I'm gonna lock your pelvis. Open up as far as you can. There you go. Good, come back. And I'm gonna lock your pelvis in. Go ahead, let's do 3 of these. And exhale all the way, open up the book. Good. Come back, Close up, dude. Close up. Super close. Right in here. So he doesn't have as much tension as I expected in here, which is great. Good. Okay. Multifidi are responsible for extension as well as rotation. So we're gonna do almost the same thing. They run this direction. I can almost guarantee you will find something here. So we're gonna come in, we're gonna palpate. Like he's got something right there. That hurt? A little tension there?
No.
Okay. I want you to do the same thing, but except you're gonna kick your right leg off a little bit. So kick your right leg,
Okay.
this top leg, kick off, like almost like kick the door almost. There you go, right there. Now a little further, a little further, a little further, good. And now rotate. Good, now bring them both back together. Good, and now do the same thing at the same time. Go ahead. So kick the leg and extend back, there you go. You okay there? Good, 2 more. Good. There's a great way to do this seated too. Let's do the other side and just work a little bit of the multifidi on the other side. Good. Surprisingly, you have more tension in this side. You're right there. Nice, nice. Hold that there. Good, come back. And 1 more. Kick that leg off. There you go. So my left arm is doing the work and the right is just reinforcing. Good, come back. Okay, let's have you stand up, walk around. So the one thing that kind of hurt you is lateral bending. Let's see if we can bend back through it.
I just feel a touch.
A touch?
A touch, yeah.
Okay, what about flexion? Bending forward?
Again, a touch on both sides. Look,
Okay.
that's how I feel.
Okay, let's have a seat. I find that there's a ligament called the supraspinous ligament. I love to work the supraspinous ligaments. Basically, the ligaments in between each vertebra. So you're gonna cross your arms here, give yourself a big hug, and steal this from me so because I'm gonna be pushing into you. We're gonna come in and we're just gonna rotate. I'm gonna push you this way. I want you to round your spine down here. So round your spine here, there. Good. It's a subtle, subtle movement. There it is. Sometimes when people have issues flexing, it's usually pretty, like it almost feels like a knife, right?
It looks like a little needle.
Yeah, it feels like somebody's like poking you with a little screwdriver there. You okay? Okay. So he would probably benefit from more of a posterior chain strengthening, aka glute, hammy, back extension, tolerance, like a back extension thing, but more of an isometric hold to start, which would be part of his homework at protocols at home. And so what I like to do is I like to test, treat, retest, see if we made any progress. So let's go ahead, stand up, let's bend forward again.
It's almost, it's lighter, it's very light. Yeah.
Easy?
Yeah.
Try to round all the way through. Really round the spine here.
Yeah.
Gone?
Yeah, it's just only this the right side.
So we went from, I have right-sided pain, but I'm feeling it on both sides, to now I'm feeling it in the middle, but not that bad, but now I'm feeling it only on the right. So we're slowly starting to localize the pain. I think in this case, because of the loss of range of motion in that right hip, we'll do some right hip work. So on your back, I like to work rectus femoris because it does have its attachments to the glute med as well as the hip joint within the capsule. So right here, I'll come in. Basically anybody who has back pain, hip pain, or needs to be more athletic, I personally think that everybody can use hip flexor work. Even if you feel great, I think, and for him, he'll need more of that push and that internal rotation. And I'm kind of oscillating. I don't like to just push and hold. You okay? Feels kind of aggressive, but good. So how do we know if this is even effective at all? Test, retest, right? A little bit better on that external. I'm gonna work a little bit of the pectineus here. So it's a small, powerful muscle, small relatively speaking, contributes to adduction. So basically it does this and keeps it from going here. So what we're doing is we're lengthening it under some tension. Doesn't feel like a big muscle to add tension to, but it's right there. Now you feel it. It's intense once I get in there. Look at that. That's all right. Let's have you stand up. So again, this is if this goes away, it shows us that some of the hip flexion and something you probably didn't catch on the camera I didn't mention, you have a little bit more thickness on the right side. Nobody's gonna be perfect, but when you bend forward, you can see like one side's a little thicker on the other side. So let's bend down, touch your toes, and see if that makes a change. 100%?
Almost, yeah.
Almost. So let's adjust you then. I know you're waiting for that part. That's what he wants the most. All right, let's go on your side. We'll adjust the lower back. It doesn't matter. Face me first, actually. Yeah. We want the right side up first. I typically like to get the involved side first. Straighten this bottom leg. Bend that. Perfect. You okay there? Yeah. Look up for me. Good. That was intense. It may have not been loud, but there was a lot of movement in there. I know you felt that. But let's do the other side as well. I mean, we're basically increasing the space within there. So there is some evidence to say that after 20 to 30 minutes, that the air bubbles will kind of reabsorb, and you'll be able to do this every 30 minutes. However, there is a big thing about pain reduction, and that's why like I'm not a huge fan that every single person needs to be adjusted, but I really believe that they really do help significantly if applied correctly and to the right person. You okay there?
Yeah.
This way it's gonna make more noise. Like I said, told you. Okay, let's go onto your back. Cross your arms, big hug. Tuck your chin to your chest. Good. Relax your head, relax your head. Look up with your eyes. Eyes, look up to the wall. There you go. Relax your head. Good. Good. You okay? Yep. Good. There you go. There you go. You okay? No problems with the neck? That means being good. Sorry, it's a little warm in here. Take a minute. Just stay there for a second or two. I think that after adjustments, most chiros and PTs are very quick to just like, all right, good job, you did great today, let's go. I'm not a big fan for that, and I think adding time for people to actually receive the benefit of the adjustment and actually like relax for a minute, whether that's 1 minute, 3 minutes, 30 seconds, 7 minutes, I think that's where a lot of the benefit of the parasympathetics come in, is actually allowing people to do the relaxation component. What's the point in getting adjusted to feel better, to have more relaxation, if you're just gonna rush them off your table? So that's just my opinion on it. So however long you need to stay here for, that's cool with me. If you wanna fall asleep on the floor, that's cool too. If you want, we can go home and eat ice cream too.
Thank you.
Yeah.
Thanks a lot.